Welcome to our video on blood tests and other investigations, where we'll walk you through each of those tests and what they mean. So when your family doctor suspects systemic sclerosis, they might want to do a whole series of blood tests, and that would include what we call the complete blood count. That looks at your hemoglobin, your white cells, which are your army cells, and your platelets. And we might find some abnormalities there. The family doctor may also want to look at your kidney function to make sure that that's normal. That's a test called creatinine. And they may also look at CRP, which is a level of inflammation in your blood. Other tests they might do are liver tests and urine testing. To narrow it down and being more specific for an autoimmune disease, we look at a test called an ANA, or anti-nuclear antibody. And that test tells us whether the immune system is attacking itself. And then we break that ANA test down to various other components, which might give you a blood test that makes it more likely that you have systemic sclerosis. An important thing to mention, though, is that some of those blood tests can be positive even if you do not have systemic sclerosis. And we look at, so when you get to see a rheumatologist, we will then look at those markers much more carefully, see what level they're at, see whether they're more predictive or less predictive of a disease like systemic sclerosis. And then we tie in those patient symptoms with the blood test to decide how important they are. Now, the scleroderma specific blood tests, again, need to be seen in the right clinical context. There are three that we measure routinely. One is called anti-centromere antibody, and that's most commonly associated with a condition called limited cutaneous systemic sclerosis. Anti-SCL70 is also called anti-topoisomerase, just to be confusing. But anti-SCL70, if we see high levels of that, it is most often associated with the diffuse cutaneous systemic sclerosis. And then a third antibody that we measure, sometimes we have to send this test out to other labs, is called RNA polymerase III. And that antibody is really important to know because it's associated with a condition called scleroderma renal crisis. And you can imagine by the name, that's not a good thing to have, and it's something that we should be cognizant of and looking for. And your doctor and your rheumatologist or family doctor may order other tests as well. So the testing, I've just explained blood tests. Other tests that we will do once we've made the diagnosis is we routinely look at heart and lung, both imaging and function of those organs. So the lung imaging would be a chest x-ray and sometimes a CT scan or a CAT scan of your chest. The lung function testing is where you blow into a machine and we get a report of how well you can breathe deeply, how big your lungs are, but also how well the gas can exchange between the lung and the blood vessels and back. And then the cardiac testing would be a trace of your heart, or an ECG, and an echocardiogram where we look at the function, how the heart is pumping. Other testing that we may order, sometimes if you have gastrointestinal involvement, we may look at how the swallowing goes or how well the bowel is functioning. And those are the main investigations that we would do in systemic sclerosis. So that wraps up that short video. Thank you.